Hello, my name is Dr. Maya Kumar, and I'm an adolescent medicine physician at the University of California, San Diego. This video was produced by the American Academy of Pediatrics California Chapter 3 as part of a larger project for HPV vaccine provider education and promotion. Human papillomavirus, or HPV, is the most common sexually transmitted disease in the United States. But more importantly, it is estimated to cause 1 out of every 20 cancers occurring worldwide. Unfortunately, although an effective vaccine against HPV has been available in the United States for 10 years, less than half of American adolescents have completed their HPV vaccination series. In this video, we will outline the burden of HPV-related disease, review general information about the HPV vaccine, discuss common barriers to vaccination, and suggest effective counseling strategies that providers can use to increase vaccine uptake. We will also show you some video clips that demonstrate these techniques in action. As I mentioned before, HPV is the most common sexually transmitted infection in the United States. Almost 80 million Americans are currently infected with HPV, and 14 million new infections occur every year. It is important to point out to patients that unlike some STDs like chlamydia or gonorrhea, which are only contracted by a minority of sexually active people, the lifetime probability of contracting HPV is 85% in women and 90% in men. More than 80% of the population will have been exposed by age 45. Parents and patients need to hear that unlike many other STDs they may have heard of, HPV does not primarily affect people who are engaged in risk-taking behavior. It affects almost all sexually active people, including those in responsible and monogamous relationships. It is also important to note that about half of HPV infections are caused by cancer-causing strains, also referred to as high-risk types. HPV is associated with many different cancers. The most well-known is cervical cancer, of which almost 100% of cases are HPV associated. Despite the widespread employ of routine Pap screening, every year in the USA there are 12,000 new cases of cervical cancer and 4,000 deaths from cervical cancer. Other common HPV-associated cancers include oropharyngeal cancers, of which 70% are HPV-related, anal cancers, of which 95% are HPV-related, penile cancers, of which 35% are HPV-related, and vulvovaginal cancers, of which over half are HPV-related. Although pediatric providers generally focus on the cancers caused by HPV, it is important to note that HPV-related genital warts affect 1% of American men and women at any given time. And while genital warts are not life-threatening, they are still associated with significant morbidity and reduced quality of life.